KCBS, in partnership with UCSF Health, presents As Prescribed, a weekly conversation with leading medical experts from UCSF Medical Center and UCSF Benioff Children's Hospitals.
Hello and welcome to As Prescribed. I'm Kathy Novak. Have you ever had a health issue and been passed from specialist to specialist and still ended up with no diagnosis? Well, that's a problem that UCSF is trying to solve for neurology patients. Dr. S. Andrew Josephson is professor and chair of neurology at UCSF, and he's helping to lead the new Joan and Sanford I. Weill Neurosciences building at Mission Bay. He joins us today to tell us more about it. Dr. Josephson, welcome to As Prescribed.
Thanks so much for having me.
So, Dr. Josephson, this new initiative is aiming to solve the mysteries of the brain. What's going to be unique about it?
Well, what we've decided is that we really want to be very bold in our vision for this new building and this new clinic. We know that disorders of the brain are unfortunately extraordinarily common. There's very few of us who don't have a family member or a loved one who has some neurologic or psychiatric or neurosurgical disorder. And unfortunately, a number of individuals who have these kinds of problems just have trouble finding the right diagnosis. Often, as you mentioned in the introduction, pass from one specialist to another, trying to find answers for conditions that can be relatively mysterious. And what we've tried to put together is a really unique approach to patients to try to bring together specialists from many, many disciplines to give people the answers that they need and the help they deserve.
And you're talking about everything from, say, headaches and migraines to Alzheimer's disease, right?
Yeah, it's quite amazing that when we think of the broad spectrum of disorders of the brain and nervous system, as you say, a number of these are really common. Headaches, migraines, back pain, neck pain. Others are disorders that we've all heard about: stroke, seizures, Alzheimer's, Parkinson's. We could go on and on. But there's a whole other category of diseases that are just difficult for people to get a hold of, difficult for the right diagnosis to be made. And we're talking about this entire spectrum of these illnesses. And in addition, the traditional approach is that neurologic diagnoses and psychiatric diagnoses, those are seen by different specialists in different clinics. And we know that all of these are conditions where the brain and nervous system are not functioning as well as they should, as well as they could. So we're trying to break down those traditional silos, if you will, and think of this as one set of diseases that affect the nervous system.
How much of a shift is that? Is it another acknowledgement that mental health is really part of health?
Yeah, I think it really is. We have to stop thinking of all of the stigma that goes with mental health, and our psychiatry department, led by Dr. Matt State and his colleagues, have really been some of the foremost folks in the country who are thinking about defining mental health as health, no different than any other disorder. And we think of these brain disorders as all, very similar. It's the same continuum despite these historical silos.
And this, of course, is all happening with the backdrop of the pandemic. COVID threw a few more mysteries in there, brain fog, for example. Are these the sorts of things that you'll also be looking at?
Absolutely. I think these are the kinds of conditions that are really difficult to define, to figure out what is the pathophysiology and how best to treat them. The building's very unique. And then in addition to having clinics throughout the building and a neuroinfusion center and MRIs and everything you need to give this comprehensive care, on the top floors of the building are a laboratory-based and a clinical-based research centers. And so what we're trying to do is to take the discoveries that occur on the top floors of the building and rapidly translate them so that we can get patients the diagnoses and the treatments they deserve. And these types of illnesses that you're describing, COVID being an example, is something that we're working on in our labs and hopefully can translate to great solutions for our patients.
And if I stick to that COVID example and the brain fog, we speak to doctors and experts, ask, what do we know? And so often they say, well, this is new. This is something that we're still looking into. On the mysteries thrown up by COVID, is there more we know now than we did a year ago?
Oh, I think there's no question there's a lot more than we know a year ago. I mean, interestingly, when the pandemic started, we in neurology took a deep breath and say, oh, good news. We've got this horrible pandemic, but it's not going to involve the brain. And then in about April of 2020, some papers came out that described that 1/3 of people who have COVID and are hospitalized will have some sort of neurologic or neuropsychiatric complication. And now we're learning about all these people who have these complications that last for many weeks or months or occasionally even longer. And we've learned a lot about the pathobiology. We've learned a lot about what makes this occur, but there's still many more questions than answers. And getting precision there is really what's going to allow us to figure out how to help people with these conditions from COVID.
And who are the patients that you are expecting to come through the doors? Do you have advice for people who may hear this and say, oh, that sounds familiar. I have had this persistent headache and no one can tell me what's wrong with me?
Yeah, I think that if you're a patient and you have a neurologic or neuropsychiatric condition that really has escaped diagnosis, that you've gone to a bunch of individual physicians who are well-meaning, thoughtful, but they say, it's not quite my specialty, or this doesn't fit the area of expertise that I have. This is the type of clinic that's right for you. This is a clinic where we're going to bring together neurologists across many specialties, neurosurgeons, psychiatrists, who can look at an individual patient and say, what are the advanced tests, or what is the proper diagnosis here, so that we can start a treatment plan, and then if we need to, get you to specialists that specialize in that specific diagnosis. So I think sort of up to the patient. If you think there is a condition that has been undiagnosed, that's the kind of clinic that we're building here. It's actually something quite unique in the world of neuroscience.
And is it, on the practicality side, just as simple as really just having all of these different specialists in one building physically?
Yeah, so that's a large part of it, is getting the right people together, but also a set of specialists who really specialize in these types of mysteries, in patients who have gone through a diagnostic odyssey from person to person and just can't figure it out. Doctors who their main role is to try to bring it all together, unravel those mysteries, try to get a precise diagnosis and go from there. We're lucky that the building includes, as I mentioned, a couple MRI scanners, including a research-based MRI, all these important laboratories, a neuroinfusion center, a blood draw center. So we're able in a single visit to really get accomplished a lot of things that would take multiple visits in a usual practice, going from place to place. So it's bringing together the right experts, but people who are dedicated to helping patients just like this.
Well, Dr. Josephson, thanks so much for taking the time to tell us about it today.
Thanks so much for having me.
Dr. S. Andrew Josephson is professor and chair of neurology at UCSF, and I'm Kathy Novak. Thanks so much for tuning into As Prescribed.
As Prescribed, every Thursday at 1:30, right here on the Bay Area's news station, All News 106.9 and AM 740 KCBS, and streaming on the Odyssey app. The proceeding was sponsored by UCSF.